That's great to hear that point of view. And now we're going to move on to hear a different point of view. It's now my pleasure to introduce Dr. Wong Chen Seong from Singapore, who's going to give us the clinician's view on the impact of stigma. Dr. Wong Chen Seong is a consultant physician at the Department of Infectious Disease at Tan Tock Seng Hospital and also works at the National Centre for Infectious Diseases, where he is head of the clinical HIV program.
Right, so I'm here today to really talk about the role of the clinician in terms of reducing the stigma experienced by people living with HIV, with a bit of a focus on how we can use that to further the aims of U equals to U. So first of all, I really want to start by talking about how I have experienced, as a clinician, as a physician, HIV stigma. Now, I'm not someone who's living with HIV myself, but I've been involved in caring for and providing, clinical care for people living with HIV for a number of years now. And I think over this time, I've actually had several close brushes with HIV-associated stigma. The first one is really in terms of providing medical care. Sometimes some of my patients may actually have been denied certain dental, surgical, or other medical services on the sole basis of their HIV sero status. And this is, of course, greatly upsetting to me. And we've often had to engage these other providers and explain to them that people living with HIV, especially if they've got virally suppressed situations, don't actually pose any health to these providers. Sometimes, however, and perhaps even more frustratingly or sadly, is that our people living with HIV, my patients, because they anticipate that they might experience some stigma or discrimination, don't come forward and seek help for medical problems that they might have. Apart from this, my patients may also tell me stories of the stigma that they experience outside of the medical field, the stigma and discrimination that they feel at home, at work, and in school sometimes even. And these stories of being called names or being shunned, being thrown out of their homes are unfortunately all too common. And they tell me as their physician, sometimes hoping that I can help them in some way. Another way that I've experienced HIV stigma is sometimes the discrimination and stigma that I feel as a HIV clinician myself, where it's often a situation where my colleagues may view me as being a lot of, or very much of an advocate or an activist for my patients, because we've had a history of fighting for the best interests of our patients. Sometimes not understanding that people living with HIV are already so marginalized that what we are doing is just trying to fight for them to be accorded the bare minimum of dignity that people of other medical conditions already enjoy as a privilege. And the last way in which sometimes I feel HIV stigma can be experienced as clinicians is where HIV knowledge, the science, doesn't always get translated into HIV practice at perhaps a policy level or an institutional level. And this is really where we see the practice gap between the really strong evidence we have for U equals to U and treatment as prevention, and yet sometimes there's that gap between policy for universal access to antiretroviral therapy or subsidies or financial aid for people who may need treatment. So I really want to talk about how the clinician can work and strive to reduce HIV stigma. And I'm going to propose that as clinicians, we can do so in one of 4 different ways: as practitioners, as advocates, as educators, and as researchers. So first of all, I think, I'm here to speak as a clinician, and many of us who are medically trained, we identify first and foremost as practitioners, as physicians, as doctors. I think the most important way and perhaps the most effective way of being able to reduce stigma in this role is just by being mindful of who we are, the roles that we play in the lives of our patients, of being mindful that we need to be evidence-based in our prescribing and in terms of providing clinical care, something I think most of us take for granted and do almost instinctively, but being mindful that there is good evidence out there to say that U equals to U holds true. and can help in terms of reducing the stigma experienced by our patients. Secondly, in terms of being patient-centered, patient-focused in the care that we provide and transforming the entire HIV care continuum and ecosystem all the way from waiting room to home. And we can do that in our role as clinicians by ensuring that the practices, the settings in which we provide care, everyone in that link, in that ecosystem are trained the same way, they know the same science, and they know the same methods in which to speak to our patients, to treat our patients, and interact with our patients to reduce any stigma that our patients may have felt in the past before. Of course, as doctors, it's also important that we tell our patients about U equals to U. We tell our patients that they are not able to transmit the virus if they're on treatment and have viral suppression, something that we may take for granted, but it's important to tell people living with HIV that we see in our practice and in the course of our work. Now, next is as clinicians being advocates. And this is where I feel, as doctors, as physicians, we are in an ideal position to advocate for and to rally for our patients. We have a privileged position as professionals, as experts, and as prescribers. And hence, we really should be leveraging on this privileged position to do all that we can. We have a unique long-term relationship with our patients. It usually starts off as a physician-patient relationship, but in my own experience, it can often develop into something that's deep, that's meaningful. Our patients, for many of my patients, I'm the only one who's aware of their HIV diagnosis, and I hope to continue to grow and develop that trust and rapport that I have with these patients. As clinicians, and as content experts and as key opinion leaders, we often have an influence on policy at various scales, either just as doctors, as prescribers, but also sitting on committees, sitting on advisory boards. And in all of these roles, I think we have to bring in our professional position and argue and fight for the best interests of our patients, including reducing the stigma and discrimination that they may face. A clinician as an educator is something that I feel particularly strongly about because I'm also actively involved in training, young doctors all the way from medical school to postgraduate and infectious disease and HIV training. And I feel that because medicine remains essentially at its core an apprenticeship, we impart not only just medical knowledge, we also impart attitudes, we impart values, and we role model behavior for those that we train and those that we teach. And so I think as doctors, we have to try and make sure that we design HIV education with stigma reduction at the forefront, having it in mind, putting it into the DNA of our syllabus, our curriculums, and in teaching about HIV. I want HIV, and I feel that HIV should be incorporated into medical education, not only at undergraduate level, but at postgraduate level, even for people, even for trainees, or even for medical specialties where HIV is not at its core. So traditionally, not necessarily just in terms of genitourinary medicine or infectious diseases, but in internal medicine as a whole. And in doing so, we need to also include and incorporate concepts of treatment as prevention and U equals to U, all the way from the virology and the microbiology of it to this clinical management, and even using HIV as a hub for teaching clinical communications, for teaching medical legal ethics, for teaching public health, caring for underserved populations, gender and sexuality studies, and so on. So in short, using HIV and taking HIV to be a central nexus for clinical education and teaching people about reducing stigma at the same time. Last of all, it's about being a researcher as a clinician as well. So HIV stigma and how to combat it must be vigorously and rigorously studied as an important topic in HIV research. It must be researched from the point of view of stigma reduction from the points of providers as well as patients alike. We need to study the determinants of stigma and what interventions work best in reducing stigma. We must prioritize implementation science research looking at U equals to U and to bridge that gap that I talked about just now between the science of it and its implementation and interventions. And we must continue to advocate for the involvement of people living with HIV in clinician and investigator-initiated clinical research alike. This is something that we as clinician researchers are in a unique position to be able to do. So in these 4 roles, I believe the clinician is in a great position to reduce HIV stigma and to push for U equals to U in this exciting future that we are on the cusp of. Thank you very much.